to my colleagues. Today I'm going to explain on flexibility, one of the rehab component as well. So first I will start with the definition. So definition wise is the ability of a joint or series of joints to move through unrestricted and pain-free range of motion. So the definition that related to the term is basically you need to know the stretching. Stretching is an activity where a person put a longitudinal force on the muscle just in order to increase the range of motion. So what is meant by elastic effect? So if elastic effect is increased in tissue length, when that will return to normal if once the stress is removed. So if it's viscous, it will be increased in tissue length depending on the time. So it will return to the original at a slower rate. So if plastic effect is different, so it's a change in a structure without any complete tearing. So there is called as plastic deformation. So plastic deformation is total damage to the tissue actually. So the other term that I want to explain is flexibility training. So it's a program of stretching stretching exercise designed in order to increase the range of motion of targeted joints in order to get the desired level of fitness. So the next thing that I'm going to explain is the specificity in the flexibility training. So increase in range of motion with stretching usually depends on the muscles being stretched. So if any muscle not move for particular range of motion for a long period, so for sure they will lose the range of motion. So another thing that I'm going to explain is the effect of the temperature effect of temperature in the flexibility training. So if we increase the stretch effect, so if the tissue warm so the next one is I'm going to talk about the age and gender difference. So they said that the female noted to be more flexible than the male. Okay, and it's not because of the sex hormone actually, they said. Till now they say the factors still undetermined, and usually the flexibility changes as per level of activity. So when at age 1, usually the flexibility will start increasing when the baby start to walk. So at age 5 to 8, usually when they are going to a primary school, that they need more sitting in the school, so it will steady decline in the flexibility. So when going towards age 12 to 14, so means the patient is the person is going to secondary school, means there will be increase a bit in the flexibility. So towards the end to age 20 to 24, so there will be a steady decline of flexibility, then there will be increase in flexibility. So basically the flexibility is involved with the stretch reflex, usually mediated by the muscle spindles, okay, causing usually the stretch muscle will contract and prevent the other excessive range of motion. So the role of flexibility in injury prevention. So they say that there is a graph that showing that the relationship between the flexibility and the risk of injury. So usually it's in a U shape. So those with the higher risk of injury is the one with inflexible and extremely flexible, means hypermobility. So those had so with the extreme flexible hypermobility. So the next one I'm going to talk is about the role of flexibility in performance enhancement. So this one is the acute stretch versus the regular stretch. So if you do a very short stretch, means it will weaken the muscle, but it cannot produce more force, cannot contract rapidly. But if we talk about regular stretch, usually it will increase the force and velocity of the contraction. And example we can see is in ballerina and running. So usually in ballerina they prioritize more on aesthetic compared to the height of jump. So means if the stretch is being done perfectly, so the aesthetic will be perfect as well. So even though the height of jump is less than 2 cm, so they prioritize more on the aesthetic. So the other one is running. So running usually with each step energy will be lost. But let's say if the gastrocnemius is stiff, so the energy loss will be less actually. So that is what meant by that actually, performance wise. In roles of rehab, stretching and rehab following an injury, so usual range of motion must be restored before any strengthening. So another thing that I'm going to tell is about the types of stretching. So there are few actually. So for the static one, usually will hold a stretch for a point, a moment. So most of us will do the static stretch usually, and the dynamic and ballistic stretch is like moving joint throughout the regular range of motion. So any exercise we are doing, so it's not like it's a static or what, it's dynamic. So it's called as means moving, so it's dynamic. So PNF is a combination of muscle contraction with passive stretch. So means it's a proprio neuromuscular facilitating. So yeah, this is including with the contraction with the passive stretch. So this one usually we need someone with a flex band, with the help of a flex band, and the active stretch is performing a stretch by contracting the antagonist muscle. So basically, if you want to stretch a hamstring, so we have to contract the quadriceps. So that is called as an active stretch. So that's all.